Welcome to the Dr. Izzy's Medical Podcast channel.
Question: which HLA subtype is associated with psoriatic arthritis? Answer: HLA-B27. Question: which HLA subtype is associated with reactive arthritis, also called Reiter syndrome? Answer: HLA-B27. Question: which HLA subtype is associated with rheumatoid arthritis? Answer: HLA-DR4. Question: which HLA subtype is associated with SLE? Answer: HLA-DR2, HLA-DR3. Question: which HLA subtype is associated with T1DM? Answer: HLA-DR3, HLA-DR4. Question: which HLA subtype is associated with the arthritis of inflammatory bowel disease? Answer: HLA-B27. Question: which HLA subtype is associated with the seronegative arthropathies? Answer: HLA-B27. Question: which hypersensitivity reactions are mediated by antibodies? Answer: types 1, 2, and 3. Question: which immunoglobulin isotype binds mast cells and basophils? Answer: IgE. Question: which immunoglobulin isotype crosses epithelial cells by transcytosis? Answer: IgA. Question: which immunoglobulin isotype exists as a monomer on B cells or a pentamer when secreted? Answer: IgM. Question: which immunoglobulin isotype fixes complement and is able to cross the placenta? Answer: IgG. Question: which immunoglobulin isotype function to opsonize bacteria? Answer: IgG. Question: which immunoglobulin isotype functions to fix complement but does not cross the placenta? Answer: IgM. Question: which immunoglobulin isotype functions to neutralize bacterial toxins and viruses? Answer: IgG. Question: which immunoglobulin isotype has the lowest concentration in serum? Answer: IgE. Question: which immunoglobulin isotype is deficient in ataxia-telangiectasia? Answer: IgA. Question: which immunoglobulin isotype is involved in type 1 hypersensitivity? Answer: IgE. Question: which immunoglobulin isotype is involved in type 2 hypersensitivity? Answer: IgM, IgG. Question: which immunoglobulin isotype is involved in type 3 hypersensitivity? Answer: IgG. Question: which immunoglobulin isotype is produced in the primary immediate response to an antigen? Answer: IgM. Question: which immunoglobulin isotype is the main antibody involved in the secondary delayed response to an antigen? Answer: IgG. Question: which immunoglobulin isotype is the most produced antibody overall? Answer: IgA. Question: which immunoglobulin isotype prevents the attachment of bacteria and viruses to mucous membranes? Answer: IgA. Question: which immunoglobulin isotypes are expressed on the surface of mature, naive B cells? Answer: IgM and IgD. Question: which immunoglobulin isotypes mediate the classical complement pathway? Answer: IgG, IgM. Question: which immunological isotype is one of the two primary opsonins in bacterial defense? Answer: IgG. Question: which immunosuppressant is associated with hirsutism and gingival hyperplasia? Answer: cyclosporin. Question: which immunosuppressant is associated with insulin resistance and hyperlipidemia? Answer: sirolimus, rapamycin. Question: which immunosuppressant is associated with nephrotoxicity? Answer: cyclosporin, tacrolimus. Both calcineurin inhibitors are nephrotoxic. Question: which interferon is used to treat chronic granulomatous disease? Answer: IFN gamma. Question: which interferon is used to treat chronic HBV and HCV? Answer: IFN alpha. Question: which interferon is used to treat condyloma acuminatum? Answer: IFN alpha. Question: which interferon is used to treat hairy cell leukemia? Answer: IFN alpha. Question: which interferon is used to treat Kaposi sarcoma? Answer: IFN alpha. Question: which interferon is used to treat malignant melanoma? Answer: IFN alpha. Question: which interferon is used to treat multiple sclerosis? Answer: IFN beta. Question: which lymph node cluster drains the stomach? Answer: celiac. Question: which interferon is used to treat renal cell carcinoma? Answer: IFN alpha. Question: Which interleukin's transcription is prevented by cyclosporin and tacrolimus? Answer, IL-2. Question, which lymph node cluster drains the anal canal below the pectinate line? Answer, superficial inguinal. Question, which lymph node cluster drains the bladder? Answer, internal iliac. Question, which lymph node cluster drains the breasts? Answer, axillary. Question, which lymph node cluster drains the colon from the splenic flexure to the upper rectum? Answer, inferior mesenteric. Question, which lymph node cluster drains the colon to the splenic flexure? Answer, superior mesenteric. Question, which lymph node cluster drains the dorsolateral foot and posterior calf? Answer, popliteal. Question, which lymph node cluster drains the head and neck? Answer, cervical. Question, which lymph node cluster drains the jejunum and ileum? Answer, superior mesenteric. Question, which lymph node cluster drains the kidneys? Answer, para-aortic. Question, which lymph node cluster drains the liver? Answer, celiac. Question, which lymph node cluster drains the lower duodenum? Answer, superior mesenteric. Question, which lymph node cluster drains the lower rectum to the anal canal? Answer, internal iliac. Question, which lymph node cluster drains the lungs? Answer, hilar. Question, which lymph node cluster drains the middle third of the vagina? Answer, internal iliac. Question, which lymph node cluster drains the ovaries? Answer, para-aortic. Question, which lymph node cluster drains the pancreas? Answer, celiac. Question, which lymph node cluster drains the prostate? Answer, internal iliac. Question, which lymph node cluster drains the skin above the umbilicus? Answer, axillary. Question, which lymph node cluster drains the skin below the umbilicus? Answer, superficial inguinal. Question, which lymph node cluster drains the spleen? Answer, celiac. Question, which lymph node cluster drains the testes? Answer, para-aortic. Question, which lymph node cluster drains the trachea and esophagus? Answer, mediastinal. Question, which lymph node cluster drains the upper duodenum? Answer, celiac. Question, which lymph node cluster drains the upper limbs? Answer, axillary. Question, which lymph node cluster drains the uterus? Answer, para-aortic. Question, which lymphocyte deficiency tends to produce more recurrent fungal and viral infections? Answer, T-cell deficiency. Question, which lymphocyte deficiency tends to produce recurrent bacterial infections? Answer, B-cell deficiency. Question, which lymphocyte is affected in Bruton A gammaglobulinemia? Answer, B cells. Question, which lymphocyte is affected in common variable immunodeficiency? Answer, B cells. Question, which lymphocyte is characterized by CD19, CD20, CD21 and CD40 cell surface proteins? Answer, B cells. Question, which lymphocyte is characterized by CD3 and CD28 cell surface proteins? Answer, T cells. Question, which lymphocyte is the only lymphocyte that functions in the innate immune system? Answer, natural killer cells. Question, which lymphocytes are affected in DiGeorge syndrome? Answer, T cells. Due to the thymic aplasia. Question, which lymphoid organ is the site of T cell maturation and differentiation? Answer, thymus. Question, which MHC receptor is expressed on all nucleated cells except for RBCs? Answer, MHC1. Question, which MHC receptor is only expressed on APCs? Answer, MHC2. Question, which MHC receptor presents endogenously synthesized antigens? Answer, MHC1. Question, which MHC receptor presents exogenously synthesized proteins, for example bacterial proteins, viral capsid antigens? Answer, MHC2. Question, which monoclonal antibody can be used as an RSV prophylaxis for high-risk infants? Answer, palivizumab. Question, which monoclonal antibody can be used to treat allergic asthma? Answer, omalizumab. Question, which monoclonal antibody can be used to treat ankylosing spondylitis? Answer, infliximab, adalimumab, both via TNF-alpha. Question, which monoclonal antibody can be used to treat breast cancer? Answer, trastuzumab. Question, which monoclonal antibody can be used to treat chronic lymphocytic leukemia? Answer, alemtuzumab. Question, which monoclonal antibody can be used to treat Crohn's disease? Answer, natalizumab. Question, which monoclonal antibody can be used to treat digoxin toxicity? Answer, digoxin immune Fab. Question, which monoclonal antibody can be used to treat idiopathic thrombocytopenic purpura? Answer, rituximab. Question, which monoclonal antibody can be used to treat multiple sclerosis? Answer, natalizumab. Question, which monoclonal antibody can be used to treat osteoporosis? Answer, denosumab. Question, which organ transplant is associated with subsequent sirolimus use? Answer, kidney transplant rejection prophylaxis. Question, which pharyngeal pouches fail to develop in DiGeorge syndrome? Answer, third and fourth. Question, which protein does tacrolimus bind to in order to inhibit calcineurin? Answer, FKBP. Question, which protein is deficient in paroxysmal nocturnal hemoglobinuria? Answer, DAF, CD55. Question, which type of helper T cell secretes IFN gamma? Answer, Th1. Question, which type of helper T cell secretes IL4, IL5, IL6, IL10 and IL13? Answer, Th2. Question, which type of helper T cells function to activate macrophages and cytotoxic T cells? Answer, Th1. Question, which type of helper T cells function to promote IgE production by B cells? Answer, Th2. Question, which type of helper T cells function to recruit eosinophils for parasite defense? Answer, Th2. Question, which type of hypersensitivity involves a delayed, T cell mediated reaction? Answer, type 4. Question, which type of hypersensitivity involves cytotoxicity? Answer, type 2. Question, which type of hypersensitivity involves sensitized T cells that encounter antigen and then release lymphokines? Answer, type 4. Question, which type of hypersensitivity is involved in contact dermatitis? Answer, type 4. Question, which type of hypersensitivity is involved in TB skin tests? Answer, type 4. Question, which type of hypersensitivity is involved in transplant rejection? Answer, type 4. Question, which type of hypersensitivity is not transferable by serum? Answer, type 4. Question, which type of hypersensitivity reaction causes anaphylaxis? Answer, type 1. Question, which type of hypersensitivity reaction involves immune complexes? Answer, type 3 hypersensitivity. Question, which type of hypersensitivity reaction is involved in Artus reaction? Answer, type 3. Question, which type of hypersensitivity reaction is involved in serum sickness? Answer, type 3. Question, which type of lymphocyte is associated with acute and chronic organ rejection? Answer, T cells. Question, which type of lymphocyte is associated with type 4 hypersensitivity? Answer, T cells. Question, which type of T cell does MHC1 bind to? Answer, CD8 positive T cells. Question, which type of T cell does MHC2 bind to? Answer, CD4 positive T cells. Question, which type of T cell functions to help B cells make antibodies? Answer, CD4 positive T cells. Question, which type of T cell functions to maintain specific immune tolerance by suppression CD4 and CD8 T cell effector function? Answer, regulatory T cells. Question, which type of T cell is identified by the expression of cell surface markers CD3, CD4 and CD25? Answer, regulatory T cells. Question, which type of T cell is identified by the expression of the transcription factor FOX3? Answer, regulatory T cells. Question, which type of T cells function to kill virus-infected cells directly? Answer, CD8 positive T cells. Question, which type of T cells function to produce cytokines that activate other cells of the immune system? Answer, CD4 positive T cells. Question, which type of transplants are typically associated with graft versus host disease? Answer, bone marrow and liver transplants. Question, which type of vaccine induces a strong and often lifelong immunity? Answer, live attenuated. Question, which type of vaccine often induces a weaker immune response and hence requires booster shots? Answer, inactivated killed vaccine. Question, which type of transplant rejection that presents with vasculitis of grafted vessels with dense interstitial lymphocytic infiltrate? Answer, acute rejection. Thank you for listening Dr. Izzy's Medical Podcast Series. If you want to support this project, please subscribe the channel and like this video. Thank you.